radiation therapy, it is widely believed that it's a very toxic form of treatment. Is that true? Are there, does it cause a lot of side effects?
With the current radiotherapy modalities, the side effects, the incidence of side effects have reduced drastically compared to the older forms of treatment in radiotherapy. Like we use techniques such as IMRT, then image-guided IGRT, VMET.
Okay.
So these modalities, they help in reducing the dose to the neighboring structures like rectum and all to a very great extent, and making the radiation dose highly localized to the prostate itself.
Very targeted.
Very targeted. So the risk of side effects are not as much as it used to be.
Okay.
So even though patients may have some minor side effects, like they may have an increased urge of passing stools or increased burning during maturation, they are all manageable during the course of radiotherapy. And once the course is over, they have completed with the radiation sessions, then it all comes back to normal.
So just like any other chemotherapy, the side effects are just temporary.
Yes, yes.
So once you're done with your radiation therapy, you're done with your cancer treatment, everything goes back to normal. You can go back to a normal life.
Yes, definitely. The patient can go back to his normal life.